Chapter 16 is the legal considerations and risk management. For local anesthesia, we're going to talk about the primary objective in providing dental hygiene care and describe how the risk management plays a role in accomplishing that objective. We're going to talk about the importance of the hygienist to patient communication before any treatment and also hygienist to employer communication. We're going to discuss legal issues that are related to dental hygiene treatment and prevention strategies as well. We're also going to describe the type of information that should always be included in patient documentation for the administration of local anesthetics, and we're going to list and describe 3 categories of prevention and management of injury in dentistry. We're also going to describe or discuss the procedures to reduce the risk of accidental needle exposure and post-exposure management. So starting off with risk management, some of the risk management or preventative methods to protect the dental hygienist that will be discussed include communication, accountability, legal issues that concern the dental hygienist, and also documentation. Risk management is the primary objective of providing dental hygiene care, and it assists patients in preventing disease. The primary objective of providing dental hygiene care is to assist patients in preventing disease and maintain oral health. So dental hygienists and patient communication you want to use open and effective communication, and you want to minimize misunderstandings and resolve problems, develop one-on-one relationships with patients, and work and build confidence and trust. You want to, with the minimizing misunderstandings and resolving problems, you want to do this before or while the problems are small and before they grow out of control. And then with developing one-on-one relationships with patients, this is taking ownership of one's responsibilities, jobs, and also success. You want to clearly present the benefits and the risks associated with the procedure, which is why we teach you guys PARC, procedure, alternative, risks, and questions. It's one example of an acronym to help remind one of the important topics not to forget. What I really like about PARC is it lays it all out for the patient, the procedure, the alternatives to that procedure, and then the risks, and gives them an opportunity to ask any questions. And all of that is documented, which is really nice. You want to speak at a level appropriate for the patient. So if it's too fast, too slow, too technical, too elementary, too patronizing, too much information, not enough information, you definitely want to find your balance or your professional voice when speaking to your patients. Box 15-1 gives you 15-1. It's actually 16-1, which is the sample dialogue regarding non-surgical periodontal therapy between the patient and the dental hygienist. So this is really good to review the dialogue and kind of visualize yourself speaking in a similar dialogue, or think about things that you would change about the dialogue or things that you do like. All right, so definitely use open and effective communication with the dental hygienist and employer communication. This way you minimize misunderstandings and you want to resolve problems. And develop professional relationship, work to build confidence and trust. With this level of communication, it's much easier to discuss potential liabilities and legal prevention strategies. You want to work together to develop a written office protocol if there's not one already. And you want to take the initiative to lead the review of a written policy at a staff meeting. Remember to work within the lines of the office protocol. Definitely important to communicate with your employer about the legal scope of practice, and to always practice within the regulations regardless of your employer's request. Maintain, it is the dental hygienist's responsibility to know the laws and honor those laws. Maintain proper licensure. So licensure is to protect the dental hygiene profession as much as it is to protect the public. take responsibility for lifelong learning and never exceed the scope of dental hygiene practice within indirect supervision or also general supervision. You can refer to the box 16-2, which talks about a dental hygienist legal case, and it talks about dental hygienist unlawful administration of nitrous oxide. So types of dental supervision for local anesthetic, there's indirect supervision and general supervision. With indirect supervision, dentists must be physically present on the, they must be physically premises on the premises where the dental hygienist is administering the local anesthetic. And with general supervision, the dentist has authorized the procedures to be performed for a patient, but this type of supervision does not require the presence of a dentist when the procedure is performed. So you must know the what your state specifically requires, whether it's indirect supervision or general general supervision, and you never want to exceed the scope of practice of the dental hygiene practice. Now, a state can have requirements of both kinds of supervision, but keep in mind that it's your responsibility to practice within the state laws, okay? You want to always obtain informed consent prior to beginning any procedure. Ultimately, it is the patient's decision whether they want to accept the procedure or not, but to say no to treatment is a choice, and that is a patient's right. You just want to make sure that they know all of the risks to saying no to a treatment that you're recommending. You also want to maintain privacy and confidentiality. You want to follow HIPAA. You can't, so there could be multiple reasons why a patient says no to treatment. Maybe he's tight with money, or maybe they just don't want to have their teeth clean. Always the best thing to do is just make sure that the patient fully understands the information presented and fully understands the consequences of accepting no to a treatment. So communication is a two-way street. You want to listen to what the patient is saying or what he or she is not saying as well. You want to always assess the patient's health and dental information, make appropriate referrals and consultations regarding the patient's medical status before administering any topical or local anesthetics. Utilize acceptable standards of care set by practitioners and do not experiment with local anesthetic techniques or drugs. Learn about the patient and what dental procedures are needed for that specific patient. You definitely want to administer a volume of anesthetic that's appropriate for an area and can be reasonably completed during one appointment. Inform the patient of progression of treatment and results obtained, and inform patient of any unanticipated occurrences during and after administration of the anesthetic as well. Never abruptly stop treatment or abandon a patient. Refer to the box 16-3 for a list of best practices for the administration of local anesthetics. You also want to practice in a manner consistent with the Dental Hygiene Code of Ethics. Obtain professional liability insurance to protect yourself. You want to be familiar with your policy because there may be stipulations or deadlines for claims. You don't want to rely on being covered under your employer's insurance policy. If you change insurance companies, know when one policy ends and the other begins, and allow for overlap. Document, and make sure that you're keeping accurate records. In addition to information necessary for all dental procedures, the patient should record the following for the administration of local anesthetics. So medical status, including pharmacologic history, vital signs, dental history, referrals and consultations that are obtained, patient refusal of treatment, plus brief statement documenting the discussion of risks. Also want to have a comprehensive and chronologic documentation of the treatment, including patient's MRD, drug use and concentration, vasoconstrictor, amount administered in milligrams, gauge and type of needle, name of injections, time of administration, and patient reactions or complications. Also, any unexpected occurrences that happened or reactions that happened, continued care intervals or maintenance schedule, and specific post-care instructions given to the patient as well. All right, so exposure prevention and management. Occupational exposure in dentistry is defined by the Centers of Disease Control and Prevention as percutaneous injury or contact of mucous membrane or non-intact skin with blood, saliva, tissue, or other body fluids that are potentially infectious. Percutaneous injury means a needle stick or cut with a sharp object. Non-intact skin is exposed skin that is chapped, abraded, or with dermatitis. And the type of diseases that dental professionals are at risk for contracting in the dental office are hepatitis B, hepatitis C, or HIV, human immunodeficiency virus. So the U.S. Public Health Service established guidelines that all dental facilities must address in a written office protocol to include post-exposure steps, the training and education requirements for dental personnel, types of exposures that put dental personnel at risk, and procedures for prompt reporting and evaluation. Stress you want to stress that every dental office must have these guidelines. So if for some reason you go into a dental office and they don't have these guidelines, you may want to push to have these guidelines. But again, it is a regulation, so every dental office should does have these guidelines. These guidelines must follow the OSHA bloodborne pathogen standards and any state or local law or regulation. The three categories of prevention and management of injury are primary prevention, which is striving to utilize all protocols to prevent the injury from occurring. Secondary prevention is strive to contain the injury, and tertiary prevention is strive to return to a functional state and prevent future injuries. The risk reduction protocol: to minimize the risk of needle stick injury, you want to use medical devices with safety features and use the safest technique. Never recap the needle by hand. You want to utilize the scoop technique of capping needles and utilize disposal needle systems. You also want to know the position of uncapped needle at all times. Immediately after the injection, you want to safely recap the needle and use caution when removing the needle from the syringe. Dispose of needle in the appropriate sharps container and create a neutral zone for sharps where so do not pass between healthcare workers with that sharps. Post-exposure management, so a qualified healthcare professional is an expert who is sufficiently qualified and experienced in conducting testing and providing antiretroviral therapy and sufficiently familiar with the unique nature of dental injuries to provide guidance on the need for antiretroviral prophylaxis. This person, the qualified healthcare professional, determines the source of the patient's disease status. So prevention is best, but exposures do happen. And the goal of the post-exposure management is to contain the injury and to reduce the possibility of disease transmission. The qualified healthcare professional's responsibility to determine the source of the patient disease status is the reason why there's a specific person, the qualified healthcare professional, in determining the source of the patient's disease status is to provide privacy and confidentiality for the patient. The steps to follow, so the post-exposure steps to follow would be to clean the wound and the skin sites that have been in contact with the blood or bodily fluids with soap and water, communicate the incident to the source patient, and explain the patient's role in post-exposure protocol. You also want to obtain consent for testing from source patient and set up testing for dental worker and source patient with the qualified healthcare professional. You can refer to box 16-4 in the text for more information about that as well. But then this continued, you want to complete an incident report form and record in the exposed person's confidential medical record all of these things, so the date and time of exposure, the details of the procedure that was performed, the details of the exposure, details about exposure source, details about exposed person, details about counseling, post-exposure management, and follow-up. You want to know where and how the exposure occurred, whether the exposure involved a sharp device or what type of device, whether there was visible blood, the type and amount of fluid, severity of the exposure, the depth of the wound, the gauge of the needle, whether fluid was injected, estimated volume of the material, duration of contact, condition of skin, whether it's chapped, abraded, or intact, which virus source patient was infected with, stage of the disease, history of antiretroviral therapy, and viral load if it's known. The qualified healthcare professional must consider these factors. So type of exposure, type and amount of fluid and tissue, infectious status of source, and susceptibility of exposed person. The written report and opinion of healthcare provider is provided within 15 days of evaluation. Written opinion is sent to employer, and so employee informed. You want to document that the employee was informed of evaluation results, need for further follow-up treatment, whether the hepatitis B vaccine was indicated or if the employee received the hepatitis B vaccine, and all other findings are confidential and are not included in the report to the employer. So the considerations, ethical principles guide the conduct of the healthcare professions regarding moral duties and obligations to the profession, to oneself, to the employers, and to the patients. Dental hygienists are accountable to their patient and the employers, and must take responsibility for their own actions. You want to obtain and maintain appropriate licensure for services that are provided. And a licensed dental hygienist has a contractual responsibility, whether written or oral, to the patient to provide safe and thorough dental hygiene services. A dental hygienist must meet the standard of care set by other practitioners with similar training. Always obtain informed consent and allow the patient to formally accept or deny the services. Communication between the dental hygienist and the patient is an important risk management tool. Always keep the patient informed of treatment in progress. Confidentiality of patient records is an important responsibility of the dental hygienist. The dental hygienist should always identify prevention methods that minimize or eliminate risk. Never recap the needle by hand. Always use the scoop technique. Always dispose of contaminated needles in approved containers, and know the position of uncapped needles at all times. Keep in mind that thorough documentation of treatment and reactions to treatment are very essential, and the dental hygienist must follow the most current post-exposure guidelines set by the U.S. Public Health Service. This concludes Chapter 16, which is the final chapter of this local anesthesia book. If you guys have any questions, please let me or Dr. Gonzalez know. Thank you.